Good day, guys. This is Ekole Abdullah and you, the CEO and founder of Criterion Life app. Welcome once again to a new episode on Criterion Life. For those of you just joining us, subscribe to our channel and on the notification bell so whenever we upload a content, you can make benefit from it. And for those of you that have not downloaded the Criterion Life app, simply go on Play Store and search Criterion Life app. Download it, register, and make benefits from the amazing features which we have on the application. So we continue on our discussion on diseases and informations about them and how they could be corrected with conventional medicine practice and natural medicine modalities. So our last episode we discussed on arthritis. For those of you that have not watched the last episode, we encourage you to watch those episodes and make benefit from them. So now we'll be discussing on a quite chronic health condition. We'll be discussing on asthma. So what are the informations which we need to know about it? How do asthma happen? How do one get asthma? What are the symptoms? How do you diagnose it? And how do you manage, correct, cure, and how do you prevent asthma? So the description of asthma is as follows. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways. This is the simple definition of asthma. It is simply the inflammation and narrowing of the airways, resulting in recurring episodes of wheezing, coughing, chest tightness, and shortness of breath. So, and this can happen to all people of all age. It happens to children, it happens to young adults, it happens to older adults, it happens to people even above 60s and the likes. So what is the exact cause of asthma? The exact cause of asthma is not fully understood, but it is believed to be a combination of genetic and environmental factors. Common triggers of asthma include allergens such as pollen, dust mites, pet danders, and also there are some respiratory infections that can get the airway inflamed and thereby leading to asthma. Respiratory infections such as bronchitis can worsen or can progress to asthma, and also air pollution, tobacco smoking. So those that smokes, they are more at risk. So now the symptoms. What are the symptoms of asthma? The symptoms of asthma can vary from person to person and they can range from mild to severe symptoms. But common symptoms include wheezing, a whistling or squeaky sound when breathing. When you see asthma patients, they are trying to gasp for breath because the airway is quite blocked and narrowed, it's inflamed, and they will be wheezing because they are not having that free air, they are not having that free access to air, even though the air is available, but the airway have been blocked, have been narrowed, and this will lead to whistling sounds. Coughing, and this often happens at night. It often happens at night or early in the morning. So coughing, shortness of breath, difficulty breathing, feeling out of breath, feeling as if they are not able to access the available oxygen because of the tightness of their breasts, of the tightness of the airways. Chest tightness, this is feeling of pressure or constriction in the chest. So how do you diagnose asthma? Doctors usually consider a person's medical history, perform a physical examination, and may order additional tests such as lung function tests. Common test includes but not limited to spirometry, which measures how much air you can exhale. So this spirometry will measure how much air are you able to breathe out. So this can give an hint about how well is your airway. Is it functioning quite properly when you are trying to exhale forcefully? So these are some of the tests, physical and diagnostic tests to confirm if a patient is asthmatic. So now, how do you treat asthma? How do you address asthmatic symptoms? Asthma treatment aims to control the symptoms, reduce inflammation, and prevent asthma attacks. Treatment options Conventional treatment options for asthma includes inhalers. Inhalers, this is a very common asthma treatment. When you see a patient, an asthmatic patient, you mostly see them with inhalers, and this helps to deliver medications directly to the airway. The purpose of inhaler is to directly deliver medications to the airway, and there are two types of inhalers. We have the quick relief inhalers, which are called bronchodilators. Bronchodilators for immediate symptom relief. We also have the long-term control inhalers. Corticosteroids. This helps to reduce inflammation and prevent symptoms. We have allergy medications, and these medications such as antihistamines or nasal corticosteroids. This also helps to reduce the allergies that triggers asthma attacks. Immunotherapy for some individuals with severe allergies. Allergen immunotherapy may be recommended to desensitize the immune system to specific allergens that can trigger asthmatic attack. Lifestyle adjustment is also very crucial. Avoiding triggers such as exposure to allergen. Asthmatic patients must avoid whatever can trigger their asthma attacks, like allergens. Avoiding tobacco smoke. You don't smoke tobacco, and you don't move along with those that smoke it, because tobacco is one of the major triggers of asthma. Also, air pollution can also worsen asthma conditions, so avoiding air pollution. All these can help manage asthma symptoms. Regular exercise can also improve lung function. But individuals with exercise-induced asthma may need to use a quick relief inhaler before physical activity. Because some individuals, their asthmatic attack can get worsened when they engage in exercise, because with exercise you tend to breathe quite more faster, and this can worsen some asthmatic patients' symptoms. So if you are having asthma, you want to engage in exercise, then it's recommended to use quick relief inhaler before engaging in a physical activity. So now, what are those natural medications, natural recommendations that can help to well manage asthma? So we have so many recommendations there, but let's make mention of some. We have some plants that have antihistamine and bronchodilator properties. There are some plants that have antihistamine and bronchodilator properties, and with us, they can help relieve asthmatic symptoms. The following herbs can be used to relieve asthmatic symptoms. Euphorbia aether. This is commonly called asthma plant. From the name, you can see that it means that it is basically used to address asthma conditions, and I personally have used this plant severally for so many asthmatic patients, and I can tell you that I'm having over 80% success on asthma by using this particular Euphorbia aether plant. It's a very common plant, it's a highly beneficial plant, and it works well to manage asthmatic symptoms. The plant is believed to have bronchodilator properties, meaning it helps to relax the airway. This is the reason behind the therapeutic action of the Euphorbia aether plant. It helps to relax the airway and improve breathing. It has been used in some herbal formulas or teas for asthma relief, and impressive results have been recorded. So how do you use this plant? How do you use this Euphorbia aether plant? Get a handful of Euphorbia aether plant with its roots. You get the whole plant with its roots, and you blend it. You add ginger. Roots, Euphorbia aether plant and ginger roots, like 10 average size ginger. You blend it with a handful of these asthma plants. You blend them together, and after blending them together, you sieve out the juice. Then you add honey. You add raw unadulterated honey. Whatever content, maybe whatever is the volume of the mixture, when you after blending the euphorbia ether plants and the ginger, after blending both together and you juice it out, whatever you're able to get from the extraction, maybe you are able to get maybe 1 liter as a case study, then you add 50 cl, that's 500 that's 500 mils of honey. So the honey will be half, that is ratio 2:1. The euphorbia ether and ginger extracts will be ratio 2, and the honey will be ratio 1. So you mix both of them together, and you take, as an adult you take 7 spoons 2 times daily, and as a child above 5 years you take 2 spoons 2 times daily. So we have other recommendations on the plants on the app, and you can download the app and make use of it. You see more recommendations, and that's what you have for you right now. We'll be uploading more episodes on diseases, on plants, on marriage and sex. So don't forget to subscribe to our channel, and also share the video with your loved ones, and download Criterion Life app on Play Store. Thanks so much, the Criterion Cares.